Hi there, I'm Dr. Robertson. Today we're going to talk a little bit about PRF and the value it is to you. So PRF is the grafting technique that we use now that uses the person's own healing response to help them heal faster and better. So what it uses is somebody's own blood. We take a little blood draw, the same as you would if you went to a lab. We spin it down. Here you can see 3 different sections: serum, PRF, and then the red blood cells that we don't really need. So we just take this middle section right there. Most importantly, it does 4 things. It cuts the healing time in half, reduces pain significantly, it heals the right thing in the right place much faster, and initiates clotting immediately. So those are the things that we really want to use PRF for. 2 different methods by which it can be used. One is a road rash and the other in terms of dentistry. Road rash is just easier for people to understand. This is an individual who fell while running, scraped up his hand, got road rash on his hand. And so what we did is we took a blood draw from the individual and applied it to the wound. Started to soothe like aloe to a sunburn, did like a natural band-aid. So 7 days later, normally road rash takes 2 weeks to 3 weeks to heal. This one within a week. The immature skin was much more mature. The person was able to go back to work and use the hand as normal. More importantly, in dentistry, here's an individual whose tooth was pulled a week before at a different office and then showed up at our office with an abscess on the tooth behind, so we had to pull the tooth behind. Obviously, the one in front, no PRF was added. We asked him if he wanted PRF on the tooth behind. He said yes, so we added PRF. So we took off the tooth and the patient came back 2 months later. Here's what you can see. Where no PRF was added, no bone recovery, mostly all skin formed into the socket. Where the PRF was added, great bone wound recovery, so the person had less pain and better bone recovery. You can see the difference between these 2 sites was a week, so let's give it another 2 months to see if it'll heal up. The PRF healed way better even after 2 months. Still not a great deal of bone formation back in. Same individual, same timing, same health conditions. Only difference was the site that was placed. So that's PRF, that's why we use it. Better bone healing, puts the right thing in the right place, less pain, better recovery, and immediate clotting when necessary.